Hi, my name is Anna Harper. This is my head-to-toe assessment. This is my 32-year-old patient, Steve. When coming in today, I noticed his gait, I noticed balance, and those were all within normal limits. His appearance was great for the weather that we were having today. I took his vital signs: blood pressure, heart rate, oxygen rate, respiratory rate, and his pain level. I asked him to put on a gown, wash my hands, asked him to urinate. We completed the Rosenbaum chart for near vision and the Snellen chart for distance vision. We will go through the cranial nerves throughout the assessment, and we'll go ahead and get started. So, hi Steve, my name's Anna. I'll be your nurse practitioner today. Do you have any concerns today?
No.
Okay, perfect. So we're going to go ahead and start with the head. We're going to palpate the head. Notice any trauma, bumps, bruises, any pain in the skull area. Okay. Noticing the texture and color of the hair. It is thick and coarse, a reddish brown color. We're going to palpate the facial bones. Any pain or tenderness with this?
No.
Okay. We're going to palpate the frontal sinuses and the maxillary sinuses. Okay. While we're here palpating, we're going to feel the lacrimal glands. Any pain or tenderness there?
No.
And he does not have any excess tearing from his eyes. Next, we're going to notice his eyebrows. They're at correct length, not missing any hair, and also his eyelashes. We're going to palpate around the eyes, noticing for any pain, redness, or edema. Okay, I do not notice any of that. Next, we're going to check a couple eye tests. We're going to do the confrontation test first. So, Steve, I want you to cover your right eye. I will cover my left, and I want you to tell me when you see my finger into your vision.
See it.
Okay. Other eye.
See it.
Okay, perfect. That checks periphery vision. That was perfect. Next, we're going to do the cover-uncover test, noting for any strabismus. So, Steve, I want you to pick an object in the room and stare at that object. I want you to cover one eye, uncover, okay, and the other, and uncover. Okay, no strabismus noted. Next, we're going to do the six cardinal fields of gaze. So, Steve, I want you to follow my finger with your eyes only, and that's it. Okay, and no nystagmus was noted on that. Next, I am going to look into his eye at his red reflex. I want you to stare in my ear as I look into your eye. Okay? Perfect. Noticing the color of his iris, the sclera is white, and the conjunctiva is a light pink and moist. Next, we're going to move on to the ears. We're going to start by inspecting the ears, making sure that they're symmetric, making sure that they're in line with the outer canthus of the eye. We're going to palpate the peanut and the auricle, making sure no tenderness and no masses are noted. We're going to do a couple tests on you. We're going to check the Weber test, the Rhine test, and the whisper test. So what I'm going to do, I'm going to place this at the top of your head, and I want you to tell me if you hear it in both ears or one or the other more.
Both.
Okay, perfect. That's a normal finding. Next, we're going to check the Weber test. It checks bone conduction versus air conduction. We want air conduction to be twice as long as bone conduction. So I'm going to come over here. I'm going to place this on your bone. You tell me when you stop hearing it. I'm going to move it, and you tell me when you stop hearing it again.
Stop. Stop.
Okay, perfect. So those are both normal findings. Now I'm going to go behind the patient and do the whisper test. I'm going to say a word. I want you to repeat what I'm saying.
Apple. Banana.
Perfect. Those were normal findings as well. Next, I'm going to look into the ear. Going to notice the tympanic membrane, making sure it's a pearly gray color. Noticing, making sure there's no redness, swelling, or buildup of wax. Okay. Perfect. Next, we're going to move on to the nose. We want to notice symmetry, midline, notice the septum, making sure there's no deviations in there. The nasomucosa, making sure we don't have any redness or ulcerations in there, and noticing the turbinates, making sure that they're the correct size. We also want to notice hair distribution and make sure that it's equal. Next, we're going to do this. We're going to make sure your nares are patent. So I want you to cover one of your nares and take a breath in through your nose. Okay, and repeat that on the other side. Perfect. Any difficulties with that?
No.
Okay. We could also do test the olfactory nerve here and do a smell test. But because of the video, we're just going to move on. Next, we're going to move down to the mouth, noticing the lips, making sure we don't have any dryness or cracked lips, making sure we don't have any edema or cyanosis to the lips. When we look inside the mouth, we're going to inspect the tongue, the gums, the oral mucosa, the teeth, the oropharynx. We want to note the tonsil size and the uvula, whether or not it's midline, and also notice any redness or swelling. So Steve, I'm going to have you go ahead and say ah. Okay. And lift your tongue up to the side, to the other side. Okay. Oral mucosa is moist and red. No swelling noted. Uvula is midline. Tonsils in this patient have been removed. Teeth are all intact, and we're now going to check the gag reflex. Okay, perfect. Now we're going to move on to some of the cranial nerves in the face. I want him to smile, stick out your tongue, move it side to side. Clench your teeth, and when he does that, I'm going to check for his TMJ. Okay. Squint your eyes. Okay. Puff out your cheeks. Perfect. So that cranial nerve is intact. We're now going to check the lymph nodes. We have the pre and the post auricle, occipital, tonsillar, submandibular, submental, superior cervical chain, posterior cervical chain, deep cervical, and supraclavicular. Okay, those were all normal. Next, we're going to move on to the throat. Here we're going to notice any jugular vein distension. We're going to feel the carotid one at a time, making sure that they're equal. Perfect. We're going to notice midline of the trachea and palpate that. And we can shift it a little bit. We're next going to palpate the thyroid. So I'm going to come behind the patient and have you take a swallow. Do it again. Swallow again. Okay, perfect. Next, we're going to listen to the carotid and the thyroid for any bruits. So while I'm listening, I'm going to have the patient hold their breath, and when I take the stethoscope off, you can breathe again. Hold it. Okay. Hold your breath. Okay. And hold your breath. Perfect. No bruits were heard. Next, we're going to go ahead and have the patient stand up and turn around. We're going to assess the posterior back and CVA tenderness. So I want you to tell me if you feel any pain.
No. 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 No.
Okay. We're now going to palpate, making sure we don't have any masses or tenderness here. Any masses or tenderness?
No.
Okay. I want you to bend. Next, I'm going to palpate the cervical spine. Let me know if you have any pain or tenderness. Thoracic spine and lumbar spine. And bend forward. Touch your toes. Noticing for any scoliosis or kyphosis here, which none is noted. You can stand back up. Okay, next we're going to check for tactile fremitus. And when I place my hands on you, I want you to say the words 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Next we're going to go ahead and percuss the posterior and lateral sides of the chest. We want to listen for resonance. This arm. Okay, and the other arm. Perfect. Next, we're going to check for thoracic expansion. Placing my hands at the 10th rib, I want the patient to take a big deep breath in and out. Okay, and there we notice symmetry of my hands. My thumbs came apart a little bit but came back together. We're going to check for diaphragmatic excursion, so I'm going to ask my patient to take a big deep breath and hold. Percussing until I hear dullness. Okay, and then take a breath and hold while you breathe in. Okay, breathe. Marking these two spots, my measurement should be between 3 and 5 centimeters. And it was 4, so that is within normal limits. Next, I'm going to listen to my patient, noticing any different breath sounds from the left to the right, and noticing any egophony, bronchophony, whisper, pecculatory, or any adventitious sounds. So when I place the stethoscope on you, please take a big deep breath. In and out. And out. Okay, now lateral sides. Big deep breath. Other side. Okay, perfect. I'm going to have you sit back down on the table. You can leave your gown off. We're now going to assess the patient's anterior chest and heart sounds and lung sounds. So we want to inspect the chest for breathing pattern and respirations. Respirations should be 18 or less. We want to notice any retractions or accessory muscle use while the patient's breathing, but he looks to be breathing just comfortable today. Notice we want to palpate the supraclavicular and axillary nodes. Those are normal. We want to palpate the chest, making sure we don't have any tenderness or masses. Any pain with that?
No.
Okay. Next, we're going to palpate the sternal border, cardiac border. Any pain there? Okay, I did not notice any heaves or thrills. We're going to percuss the chest now, noting for resonance. Perfect. Next, we're going to listen to the heart, lungs, and heart and lungs, and test for tactile phrenicis in the front. So again, I want you to say 99.
99, 99, 99, 99, 99, 99.
Good. Now going to listen to the lungs. Take big deep breaths when I place this on your chest. Okay. Perfect. No adventitious sounds noted. We're now going to listen to the apical, pulmonic, Erb's point, tricuspid, and mitral valves. Listening to the heart. Breathe normal. Okay, and S1 and S2 were heard. There were no murmurs noted. Next, I'm going to have you lay down on your left side.
Head down here. Okay.
And I'm going to listen to those heart sounds again. Kind of brings the chest closer to brings the heart closer to the chest wall. Perfect. Next, we're going to lay on our back. I'm going to do the abdominal exam. So I'm going to come on the other side. With tangible lighting, I'm going to look at the stomach, get down on the side, make sure I don't notice any odd pulsations or masses. Okay. I'm going to auscultate all 4 quadrants of the abdomen, listening for up to 5 minutes for abdomen breath sounds. Okay. Next, I'm going to auscultate the aortic, the renal, the iliac, and the femoral pulses, noticing for any bruits with the bell of my stethoscope. Renal, iliac, and femoral. Renal, iliac, and femoral. Next, I'm going to do I'm going to percuss next. I'll notice tympany over air-filled spaces and dullness over organs. Okay, perfect. Next, we're going to percuss the liver border. It should be between 8 and 12 centimeters. So let me get my pen and this. Okay, measure. And it is 9.5, so that is a normal liver span. Next, going to palpate, percuss for the spleen. Okay, perfect. Next, we're going to do light palpation on this abdomen, checking for any pain or tenderness. Any pain or tenderness? Okay, then we can go ahead and do deep palpation. Pain or tenderness?
Mm-hmm. Nope.
Okay, next we're going to palpate for the liver. If we feel it, it should feel firm and soft and have no nodules. Take a deep breath. Okay, good. Next we're going to palpate for the spleen. Okay, perfect. Next we're going to palpate the kidneys. The kidneys are not always felt on palpation, which is a normal finding. So go ahead and take a deep breath in and let it out. Okay. And on the other side. Good. Next we're going to have the patient sit up just a little, and we're going to palpate the abdominal muscles. Okay. You can go ahead and sit up, Steve. Okay. Next, we're going to look at the arms. We're going to palpate the arms for muscle mass and muscle tone. We will look at the arms for hair distribution, any masses or swelling, any tenderness with that palpation.
No.
Okay. We're going to look at the hands. We want to look at the fingers, characteristics of color, size. Looks like this patient does bite his nails. We're going to check cap refill. Less than 3 seconds. We're going to palpate radial pulses, making sure they're equal, and brachial. Good. While we're doing the arms, we're going to go ahead and check reflexes in the arms. Radial. Good. Next, I'm going to go ahead and do the light sensation test. I want you to close your eyes. I want you to tell me where you feel this cotton swab.
Forehead, cheek, chin, other cheek.
Okay, good. Next, we're going to go ahead and inspect the legs. We want to palpate the legs for muscle tone and muscle mass. We want to look at hair distribution, making sure that we notice it being equal on both sides. We want to notice any edema that the patient may have in their feet, color, temperature of their legs. We also want to look at their feet, noticing any cyanosis on their feet, noticing temperature of their feet, and also checking cap refill there. I'm also going to check popliteal pulses. Tibial pulses, and pedal pulses. Noticing the rate and frequency and equalness of those. Next, going to test sensation on the legs. Can we turn just a little bit again?
You want to leg up?
Like, I need both legs straight. Okay, I want you to close your eyes and tell me if you feel sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull.
Now I'm going to check some more reflexes, patellar, Achilles. And then we can check for the plantar for the Babinski. Great. Next, we're going to check strength. I want you, I'll have you turn a little bit, to push up against my hands, down. Okay, put your arms out, move them up and down, and do the same with your legs, out and back. Perfect. One last thing I did forget to do was his pupils being equal and reactive to light, so we're going to go ahead and check that now. Just look straight ahead. Perfect. All right. And that was a great head to toe, and thank you for doing this with me. And thank you for watching.